Hi, Dr. David Schiller here, and today we're going to be talking about the most common cause of low thyroid, and that is a condition called Hashimoto's. It's an autoimmune process. An autoimmune process is a process by which the immune system has now targeted your thyroid for destruction. So 90% of the people with low thyroid have this problem. Now, there's a way that you can find out if you do, and that's by checking two markers on your blood to look to see if you have an autoimmune disease. One is called a TPO antibody, and the other one is a TG antibodies. These are markers that tell us if you have an immune system that's going after certain aspects of the thyroid and its function. If you do have these antibodies present, then you don't have a thyroid problem. You have an immune issue. That's what you need to go after. That's what you need to target as part of your treatment process, is to go after why that immune system has started this process. The thing is, there's no cure for Hashimoto's or any autoimmune disease for that matter, but you still can go after things that are triggering that process. And there's many things that can do that. That's going to be a topic of one of our future posts. But just know, to find out if you have the most common cause, and like I said, 90% of the people that have low thyroid have this condition. When it's being triggered, what is happening is you're literally getting that gland, it's becoming destroyed or eaten up by the immune system. The consequence of having one autoimmune process going on is that there's a 50 to 60% chance that you could have others going on. That's not a good thing. So if you have an autoimmune disease of your thyroid, you could start developing other autoimmune diseases. Or you might have had other autoimmune diseases, now you have autoimmune thyroid going on. So you need to get these antibodies checked, and if they are there, then you need to redirect your efforts to go after why that immune system has become an issue. So you need to find out what is triggering it. In most cases, there's a lot to do with food sensitivities. There could be issues with blood sugar causing inflammation. There could be stress issues. There might be other hormonal issues. But the idea is to find the different things that could be causing it, take care of those triggers, and as a result, you can start slowing down that process, because there is no cure for an autoimmune disease. But you can take efforts to try to calm down the immune system so that it doesn't continue to cause problems. One of the other things you should know is that when you do have Hashimoto's, sometimes you can actually develop symptoms of high thyroid as opposed to low thyroid, because as the gland gets destroyed, the hormones that are within that tissue get released into the system, and you actually start feeling high thyroid symptoms, like feeling hot or inner trembling, things of that nature. So just be aware that having the antibodies checked is a very good thing. Unfortunately, in mainstream medicine, if these are positive, it does not change their direction of treatment. They still just prescribe the hormones. And by the way, if you do have this process going on and your gland has become destroyed tremendously, you may need hormone replacement. Unfortunately, that may be the truth behind what's going on, but the idea, that doesn't mean that you stop the efforts to try to find out why you have it. So get those things checked. There are ways of figuring out what's going on so that you can actually start feeling better. And just know that most likely you are in that category. I'm not saying you are, but that's why you get checked. So I hope that's helpful. I hope to see you in future posts, and make it a great day.